do all the time. Or not. But our next guest is doing exactly that. Andrew Harris is a state senator from Maryland. He is also a full-time anesthesiologist at Johns Hopkins Hospital, but he decided to do something else, take on a part-time job at a smaller hospital in rural Salisbury, Maryland, and he joins us now. It is a pleasure. Andy, thanks for coming on Fox Business.
Brian, it's a pleasure to be with you.
You know what? I want to learn what you learned at Salisbury. Maybe you could hire me on as like an orderly or something. But before we do that, do we need health care reform of this magnitude in the United States?
Well, I've got to tell you, Brian, what's confusing to me is the cost of this, quote, reform. We should be reforming by giving people more choices, not by increasing government spending with a new government entitlement. I'll tell you, one of the reasons why I want to go to a rural area and practice there part-time is because the last time we had a rural health care access crisis was when, in Maryland, they decreased the Medicaid reimbursement for obstetricians when they were running out of money, and obstetricians in a large portion of Maryland just stopped delivering babies. And these always hit the rural areas first, and this is what happens when the government begins to run the health care, is they do budgeting in such a way that when they run out of money, you're not going to get health care.
Yeah, I was speaking to an orthopedic surgeon actually a couple of days ago, and he runs his own practice, has about 8 doctors, and he was saying, if we get paid at Medicare rates, we're done. There's no reason for us to work. Do you agree with that, or is he just being sensationalist because he's on one side of the story?
No, Brian, I wish that weren't true, but the worst payers are, in fact, the government programs, Medicare and Medicaid. And in some areas of the country, it's increasingly difficult for seniors to find quality physicians who accept Medicare patients. And for those children and the poor who are insured under Medicaid reimbursement rates, the waiting lines are approaching the lines that you see in Canada.
Okay. You work at Johns Hopkins, one of the finest hospital systems in the United States, or the world. People come from all over the world. Rich Saudi kings come there to get treated. So you went to work at a rural hospital in Salisbury, Maryland on the Eastern Shore. What did you find? And, you know, we hear about this 46 million uninsured, and we've kind of broken down the numbers. Is there anybody that is not getting treatment? Is there anybody that lacks health care? Maybe not health insurance, but health care.
No, Brian, under current law, of course, if it's an emergency situation or urgent and you need care, if you go to an emergency room, they can't turn you away, they're going to treat you. What we have is a lack of choice of health care access to insurance for Americans. And that's why what I think we ought to do is just increase the choice that Americans have for their health care insurance products. Not go to if we go to a public option, government-run insurance plan, in the end, that's what everything will be, and we'll look like Canada and England. And I'll tell you, Brian, I think Americans are not going to tolerate a bureaucrat making a decision for their family's medical care. It's hard enough for physicians to make those decisions sometimes. It's just impossible for a bureaucrat.
I'll play devil's advocate. I'll get on the other side of that. You know, part of the reason we hear about these high costs that private insurers are paying is because there's a lot of malpractice lawsuits, number one. We got to cover the cost, the underpaid or the non-payers, but also people are getting too many tests. Because things are covered, they tend to get too much unnecessary stuff done. Is that true?
Well, Brian, it is true, but I tell you what we do need. We need tort reform, and we need tort reform nationally if we're going to tackle that problem. The president went in front of the AMA last week and mentioned tort reform, but then to say that it's just not going to occur. That's a real problem. If we want to cut a lot of the waste out in medicine right now, I know this personally, you order tests as a physician that you don't really think may be absolutely necessary, but you're worried that if, God forbid, something turns out some way you didn't intend, you're going to be sued, and someone in a court will ask you, why didn't you order that test?
Well,
why didn't you order that MRI or that CAT
I don't know if the
scan?
Republicans have the power to stop anything, or but part of the plan is that they're apparently saying that, hey, we'll go along with some of this stuff if we agree to tort reform. But the tort lobby is very powerful, Doctor. Do you think we're going to see real change in tort reform?
Unfortunately, I agree with you, Brian. The tort reform, the tort lobby is so strong that on the national level, I think at this point it's impossible. Senator Frisch tried to do it when he was majority leader. He couldn't even do it as majority leader.
Dr. Harris, we got to go because the president is speaking right now on health care. Doctor, thank you very much. Let us go now to the president speaking about health care.